Imagine a patient who experiences vertigo, not with movement, not with position change, but with sound. Even a loud conversation or a tuning can trigger dizziness and nystagmus. This fascinating clinical entity is called Tullio phenomena. Professor Pietro Tullio of Italy first described this phenomena after experimental studies on pigeons in 1929. This is not a disorder or a disease, but it is a symptom of an underlying condition. So there will be recurrent and brief attacks of unsteadiness, vertigo, nausea and nystagmus triggered by certain types of noises or changes in the middle ear pressure. And the trigger sounds include loud sound, high-pitched voices and sustained musical notes. TP arises from thinning or dehiscence of the temporal bone overlying one of the semicircular canal. Here you can see nystagmus in this patient on hearing this loud, high-frequency sound. Usually the inner ear fluids are acting as a closed system, but when there is a tiny hole in the temporal bone, the sound wave entering the inner ear through this tiny hole can cause an abnormal pumping of the fluid, or that is the pumping of the endolymph within the semicircular canal. So the waves moving through the canal will stimulate the hair cell, and that sends signals to the brain about the head movement. And the brain misinterprets this information as head rotation and reacts by sending signals to the eyes. And the eyes compensate by rotating in the opposite direction. So a brief spinning sensation, that is vertigo and nystagmus, will result after this. So this is a pathophysiology of Tullio phenomena. And the most common cause of Tullio phenomena is superior semicircular canal dehiscence syndrome. Additional conditions linked with this phenomena include autosclerosis, perineal fistula, head trauma, and post-appendectomy and post-tympanomastoidectomy patients. The diagnosis is based on clinical suspicion, then audiometry, which shows a low frequency airborne gap. The vestibular evoked myogenic potential testing will show low threshold responses, and high resolution CT scan of the temporal bone will confirm the dehiscence, as you can see here in the white arrow. Treatment for milder cases involve simple lifestyle changes such as wearing earplug, but in some patients, surgery may be considered, which include closure of the dehiscence. So next time a patient says, "Doctor, sound makes me dizzy," think beyond the ear, that is, think of Tullio phenomena.